Hi, I'm June Margaret Miantana, and I'll be presenting on the impact of graduate nursing education on clinical judgment and decision making. I've had the honor of working with graduate prepared nurses who have just finished their MSN degree as a freshly hired clinical nurse leader with an MSN. I recently had the chance to think back on a clinical situation in which my clinical judgment and decision making were greatly influenced by the art and science of nursing. Significant clinical experience is what we're talking about. I recently saw a patient who had been diagnosed with a complicated medical condition when I was in the hospital. The patient needed emergency care since they were in excruciating pain. I had to decide as a nurse whether to give a patient a particular drug that the doctor had prescribed. Although there was a significant chance of side effects, the drug was thought to be required to relieve the patient's agony. Because of the possible hazards, I was first reluctant to provide the drug. But after talking with my coworkers, including nurses with PhD degrees, we all agreed that there were some advantages to giving the drugs than disadvantages. By emphasizing the value of taking into account the patient's quality of life and the possible effects of the drug on their loved ones, the graduate nurses contributed a distinctive viewpoint to the conversation. And I would say that the viewpoint of a nurse with an MSN is very important. In this case, my clinical judgment and decision making would have been very different from the viewpoint of a nurse with an MSN. Having just finished their studies and training, graduate nurses bring a new and nuanced viewpoint to the clinical context. When making decisions, they are more likely to take the patient's ethics, values, and beliefs into account. The graduate nurses focus on the patient's quality of life and the possible effects of the drug on their loved ones. This was a useful addition to the conversation in this instance. So, proof to back up the opinion. Research indicates that when making decisions, graduate nurses are more likely to take the patient's values and beliefs into account. Furthermore, students show that graduate nurses are more likely to place a higher priority on patient centered care, which takes into account the patient's quality of life as well as the possible effects of interview on their loved ones. Interesting. So, the effects of a postgraduate nursing education on personal views. Looking at it closely, my individual perspectives, values, beliefs, and personal ethics for making decisions in this situation have been greatly influenced by my graduate nursing education. I have learned from my schooling how crucial it is to take the patient's values, beliefs, and personal ethics into account while making decisions. Additionally, I have grown more conscious of how and the interventions may affect the patients and their loved ones' quality of life. These viewpoints have influenced how I make decisions, giving patient centered care top priority, and taking interventions, risks, and beliefs into account. To sum up my clinical judgment and making, decision making have been greatly influenced by graduate nursing education. A more patient centered approach to treatment has resulted from the combination of art and science of nursing with the distinct viewpoint of an MSN prepared nurse. I have no doubt that this tragedy, which this strategy, which puts my patient and their loved ones' needs first, will continue to influence my work as a clinical nurse leader. Thank you.